Hello, I'm Dr. Choong Fong, consultant ophthalmologist at the International Specialist Eye Center. I'll be talking about childhood cataract today. Yes, children can get cataract too. Although compared to adults and the elderly, cataracts in children are uncommon. However, the consequences of an untreated cataract or any delay in treatment is more serious in childhood cataract than in adults, making this an important condition not to be missed. A cataract is any cloudiness or opacity of the normally clear lens of the eye. A cataract causes decreased vision by interfering with the light path to the eye. Generally, cataracts in adults can be treated at any time, with little effect on its outcome. However, the situation is different for the child with cataract. This is because abnormal vision development resulting in permanent vision loss occurs when the child has a cataract. Without normal vision, the child's visual development is interrupted during this crucial period, therefore causing severe amblyopia, or sometimes known as lazy eye, which can be really hard to treat. Therefore, prompt treatment is necessary to prevent this potentially permanent visual loss. About 3 children per 10,000 children have a cataract. This means there are approximately 150 cases of infantile cataract in Malaysia per year. The incidence is variable throughout the world depending on the genetic factors, childhood infection, or infection during pregnancy. Pediatric or infantile cataracts often occur because of abnormal lens development during gestation. These cataracts may be present at birth or develop during childhood. The lens malformation can occur with other physical abnormalities and are sometimes caused by a genetic or metabolic abnormality. One such example is Down syndrome, whereby the risk of infantile cataract is higher than the normal population. However, most pediatric cataracts are not associated with other abnormalities. There are many types of cataracts, and they are generally classified according to the parts of the lens affected. The following are some examples. A lamellar cataract is cloudiness between the nuclear or the center and the cortical or the peripheral layers of the lens. A nuclear cataract is cloudiness of the center part of the lens. An anterior polar cataract is a small, usually central opacity of the front part of the lens capsule. And a posterior polar cataract is a central opacity at the back part of the lens. Another condition that can cause childhood cataract is called persistent fetal vasculature. During development of the eye, a blood vessel extends from the optic nerve at the back of the eye to the developing lens to provide nutrients to the growing lens. Failure of this blood vessel to regress during development can cause a plug-like cataract at the back of the lens. The persistent stalk extending from the back of the eye toward the cataract can cause retinal abnormalities too. Sometimes, cataract can result from traumatic injury to the eye. We call this a traumatic cataract, and it can result from either a blunt or penetrating force that damages the lens. The cataract can form shortly after trauma, or months and sometimes to years after the injury. First of all, I need to mention that not all cataracts need treatment. Some cataracts are small and off-centered and therefore not interfering with the vision. These cataracts do not need to be removed because vision develops normally, even if the cataract is left in place. However, cataracts that cause significant vision loss are typically removed as soon as possible and as soon as it's safe to do so. The visual part of the brain very actively develops during infancy and childhood. If a cataract caused a blurred vision, the visual part of the brain does not develop normally, leading to loss of vision. This loss of vision, a form of severe amblyopia or lazy eye, can be very hard to treat. Therefore, a visually significant cataract should be removed and vision rehabilitated before the brain reaches visual maturity. Even after successful surgery, the child will need to have regular treatment to reverse the amblyopia or the lazy eye. An incision is made into the eye and an opening is made in front of the lens capsule. The very soft inner part of the child's lens is then suctioned out from the capsule. Younger children may require an additional opening in the posterior lens capsule with some of the vitreous gel inside the eye removed. If possible, an intraocular lens is then placed within the lens capsule. Lastly, the incision that we made earlier are then closed with sutures. Cataract surgery performed by an experienced surgeon is generally very safe. No surgical procedure, however, is without risk. The risk of pediatric cataract surgery include infection, retinal detachment, development of glaucoma, displacement of intraocular lens, development of capsular opacity, or development of vitreous cloudiness. Once the cataract, which is a cloudy lens, is removed, the eye needs a new lens to help it focus again. And there are several methods to restore focusing ability of this eye. If suitable, the best solution is an intraocular lens implant, which is inserted at the time of cataract removal. Sometimes it is not possible to implant an intraocular lens. Instead, a contact lens can be placed on the front surface of the eye. These contact lenses are specially designed for infants and young children and can be worn for extended periods. But at times, contact lenses are not well tolerated by the child and glasses may be required instead. This option is less ideal as the glasses are often very thick and are generally not good option with especially unilateral cataract. As the refractive power of the lens of the child grows, the power both the eye requires as well as the power of the lenses and the glasses should be regularly reviewed. As you can see, a childhood's cataract is a very complex condition requiring expert assessment and treatment. Therefore, it is best to be managed by eye specialists with special expertise in this condition. I hope you enjoyed this video and thank you for watching.